I love waking up to the stillness and the peace of the morning. I take that time to meditate. That helps me process all the things I have going on in my life. I try to make sure I'm taking care of myself emotionally and physically. I exercise regularly and I eat a healthy diet. It's important for me to stay healthy because I always want to be able to depend on myself. It's not always easy. I started experiencing skin issues in my late 30s. I was on a work trip and I started noticing red blotches that would come and go all over my body. They were just visual at that time. I became scared, frightened. I didn't know what it was. When I got back from the work trip, I went to see my primary care physician. They thought it was a rash and prescribed me a topical antibiotic. After using the medication for a few days, my skin symptoms did not improve. I went to the dermatologist, whom at that time took a biopsy of my upper left breast and my inner thigh. They thought that I had lupus. Later, another dermatologist told me that I had been misdiagnosed. My biopsy showed that I had a type of cancer called Mycosis Fungoides, or MF, not lupus. He told me that MF was a rare form of cutaneous T-cell lymphoma, or CTCL. He told me that I needed to go to an oncologist. I was frustrated. It was very confusing. I didn't know which direction to go in. I remember thinking I'm going to get through it. I did not know how, but I just knew that at some point I'm going to get through it. The oncologist that I saw at first did not have much experience treating MF. I decided that he was not the right doctor for me. That summer, the spots went away in warm weather. For a few months, I didn't experience any symptoms. Later that fall, I started experiencing severe skin symptoms. I noticed that the red spots had come back in various places. My skin was itching, burning, turning scaly all over. I remember scratching so intensely that my skin was bleeding. I knew I had to get back into the dermatologist at that time. At my next dermatology appointment, I remember going in. I was barely moving, and I remember just lifting my head up and saying to her, if I can't get help today, I don't think I can go on. I started getting steroid injections. It helped ease the pain, the itching and the burning, but it was only temporary. During this time, I made up my mind to take a bigger role in my health journey. I knew I had to educate myself about the disease and the symptoms I was experiencing. I joined a group on social media for people with MF. I realized very quickly that everyone experienced it differently, and no two people had it the same. Some people had lesions that looked like bed sores. Some people had just scaling. Some people did have itching. I knew I needed to find a doctor that understood my disease. I found a new oncologist that listened to me and understood what I was going through. She stated to me that I could no longer do the steroid. She wanted me to start chemotherapy, and I did. It didn't take long after starting chemotherapy that I didn't recognize myself. I did not know how to take care of myself in that moment. I was frustrated, scared, alone. I remember telling her, this is not working. That's when my doctor recommended a chemo-free treatment called POTELIGEO to treat my MF. She said that POTELIGEO is an infusion therapy. We discussed the potential risks and benefits of POTELIGEO. We decided that it might be a good option for me. I started my 60-minute infusions once a week for 5 weeks, then went to every 2 weeks. During my treatment at the infusion center, the nurses monitored me for any side effects. I still saw some red spots on my skin, but without the pain, they were less bothersome. I remember 2 weeks after the second treatment, I was like, yes, there it is. This is my experience, and every experience may be different. Now I'm back to taking care of myself and feeling independent as I always had. I'm back to doing the activities that I love, like yoga. My advice to anyone with MF, advocate for your health to your doctor. I am not cancer-free, but POTELIGEO has made living with Mycosis Fungoides much more manageable. I stay optimistic. I just look forward to what life has in store for me next.
POTELIGEO is a prescription medicine used to treat Mycosis Fungoides, MF, or Sézary syndrome, SS, in adults who have tried at least one prior medicine taken by mouth or injection that did not work, or in whom the disease has come back. POTELIGEO may cause serious side effects that can be severe or life-threatening, including skin problems, infusion reactions, infections, autoimmune problems, and complications from stem cell transplant. Call or see your healthcare provider right away if you develop any symptoms of the following problems or if these symptoms get worse. Skin problems. Signs and symptoms of skin reactions may include skin pain, itching, skin blistering or peeling, rash, painful sores or ulcers in your mouth, nose, throat, or genital area. Infusion reactions. Signs and symptoms of infusion reactions may include chills or shaking, redness on your face, flushing, itching or rash, shortness of breath, coughing or wheezing, dizziness, feeling like passing out, tiredness, fever. Infections. Signs and symptoms of infection may include fever, sweats or chills, nausea, flu-like symptoms, sore throat or difficulty swallowing, shortness of breath, diarrhea or stomach pain, cough. Autoimmune problems. Some people receiving POTELIGEO may develop autoimmune problems, and some people who already have an autoimmune disease may get worse during treatment with POTELIGEO. Complications of stem cell transplant. Patients who receive a stem cell transplant using donor stem cells, allogeneic, after treatment with POTELIGEO may experience complications that can be severe and lead to death. Your healthcare provider will monitor you for signs of complications if you have an allogeneic stem cell transplant. The most common side effects of POTELIGEO include rash, tiredness, diarrhea, muscle and bone pain, and upper respiratory tract infection. Before starting POTELIGEO treatment, tell your doctor about all your medical conditions, including whether you have had a severe skin reaction after receiving POTELIGEO, have had an infusion reaction during or after receiving POTELIGEO, have or have had liver problems including hepatitis B, HBV infection, have a history of autoimmune problems, have undergone or plan to have a stem cell transplant using cells from a donor, have lung or breathing problems, are pregnant or plan to become pregnant. It is not known if POTELIGEO will harm your unborn baby, are breastfeeding or plan to breastfeed. Talk to your healthcare provider about the best way to feed your baby during treatment with POTELIGEO. Tell your doctor about all the medicines you take, including prescription and over-the-counter medicines, vitamins, and herbal supplements. You are encouraged to report suspected adverse reactions to Kyowa Kirin Inc. at 1-844-768-3544 or FDA at 1-800-FDA-1088 or www.fda.gov/medwatch. Please visit POTELIGEO.com to see full prescribing information as well as patient information.